Hey guys, Dr. Sean Braithwaite. Today we're going to spend a little bit of time talking about sciatica.
It's my sciatic.
How do I know if I have sciatica?
What is sciatica?
Sciatica is pain that is being distributed from the sciatic nerve. The sciatic nerve is a nerve that runs from your lower back, down the back of your leg, into your foot, up to your toes. Now this is electrical tape. It's not anatomically correct, it's not perfect. It's designed to give you an idea of what's happening and why is it happening. So we're going to place this spine right on top our human diagram, Kiana, because I want to point out a couple different things. If you look at this side of the spine, you'll see that there's soft discs in between hard vertebral bodies. And those discs sometimes can get injured and herniate or bulge. And when they herniate and bulge, you'll notice they come out and they touch this little nerve. Now most videos on Instagram are going to be some old guy taking his finger and pointing at things along the spine, and heck, that's just boring. So we're going to use a human, we're going to use some electrical tape, and hopefully by the end of today you understand what sciatica is. Study number 1. We talked a little bit about nerve levels in the lower back, the sciatic nerve traveling all the way down the leg into the foot. Crude example. Yellow electrical tape are nerves leaving the spine. Yellow electrical tape is the sciatic nerve traveling all the way down the leg into the foot. Primary sciatica starts in the lumbar spine. It can be a disc bulge like we talked about on the spine. It can be an osteophyte or a spur that's pushing on that nerve, compressing the nerve, and that creates pain traveling all the way down the leg into the foot. That is primary sciatica. So secondary sciatica is caused by this little muscle called the piriformis muscle. And we're going to use red tape today to kind of describe and talk about the piriformis muscle. It's a little muscle that resides in the glute, and it gets really, really tight in people that run, really, really tight in people that cycle. So it's commonly an overuse injury for runners and cyclists. The difference, or the way you can tell the difference, is instead of it having some lower back pain, a lot of times it'll just be pain in the glute, right around the gluteal muscles, that then travels down the leg into the foot. There's very, very small differences between it, but it's really just compression of the piriformis muscle on the sciatic nerve. Some of us very unlucky people have an anatomical issue where, believe it or not, the piriformis muscle is pierced by the sciatic nerve. Or more or less, part of the sciatic nerve goes over the muscle and the other part goes under the muscle. And when that happens, it can really create a lot of tension on that sciatic nerve and create a lot of sciatic issues, even though this problem's very, very minor. So we've already talked about 2 types of sciatica. Primary, where the nerve root's actually being impinged and it's creating pain coming all the way down the leg. And then piriformis syndrome, that's actually compressing the nerve. The third type of sciatica is created by the SI joints. There's 2 of them, one on the right side, one on the left side. SI is short for sacroiliac. And the reason the joint's named that is because it's the joint that is between the sacrum, which is the triangle-shaped bone, and the ilium, which is the hip bone, or the bone that most people think is their hip. So the SI joints are very close to the sciatic nerve. The SI joints at no point in time ever compress the sciatic nerve. SI joints share what's called the same nerve pool. Blue electrical tape is going to pretend to be our nerve pool. What I mean by that is the sciatic nerve and nerves from the SI joints all go back into the spinal cord and travel up the spinal cord into the brainstem and into the brain. And somewhere along the way, they share the same nerve pool, meaning that they go to the same place. So SI joint sciatica is really referral pain. And the big way you can tell the difference is you'll have some lower back pain right somewhere in the distribution of this SI joint. And it'll go from there down the back of the leg, but it will stop at or above the knee. That is the big difference. So So now you know the 3 different things that can cause sciatic-like pain. There's primary sciatica that starts in the lower back, something's impinging the nerve, and that's creating pain coming down the leg into the foot. Secondary sciatica that's in the glute, caused by the piriformis muscle, compression on the sciatic nerve as it goes down the leg into the foot. And lastly, referral-based sciatica, all created by the SI joint in the same general area of that lower back, but pain doesn't quite go past the knee. There are a ton of phenomenal exercises and stretches that you can do to really help the sciatic issues that you're having. A lot of them are on our YouTube channel. Please feel free to subscribe. Other than that, it's always a great idea to see a medical professional. Somebody like a chiropractor that understands how the body's moving and how to correct the root cause of what's creating your sciatic-like symptoms. Good luck with your issues and have a great rest of your day.